Do you wonder if you have celiac disease? Is it in your family? Have you gotten sort of confusing results from your doctor and you're just not sure what to think? My name is Dr. Vikki Petersen, and one of the things I spend a lot of time on is answering questions over the internet and from individuals who are confused about their laboratory tests and they're getting conflicting data from their doctor and they really don't know what to do. So back in about 2012, 2014, the 5 criteria for diagnosing celiac disease came out, and it was called the 4 out of 5 rule. So these were leading researchers from around the world, experts in celiac disease, and what they stated was 4 out of 5 criteria needed to be positive in order to make a diagnosis of celiac disease. Now, the first criteria was having symptoms of celiac disease, and that's a very long list, but it's certainly easy to find out what those are. The second point was the symptoms improve when you stop eating gluten, so that's pretty easy. Not all of the symptoms have to improve, but you have to feel better when you stop eating gluten. The third point was you have a positive blood test, and that's definitely the point of contention, one of them. We'll come back to that. The fourth point was that you have positive genetics for celiac. That's pretty easy to find out. It's a simple swab on the inside of your mouth. And then the last point was a positive endoscopy. And that is where they'll do a probe down into your upper intestine and into the small intestine and look at the lining of it and see if the villi, which are the finger-like projections that make up the lining and give your small intestine the surface area that it has, which is tremendous, it's the size of a tennis court, if those villi have degraded or degenerated. And so they call it villus blunting. So instead of the fingers, you just sort of have a flatness. And so that's what they're looking for. So several problems. One is that back before this 4 out of 5 criteria came out, there was really one criteria, which was positive endoscopy, and that was the gold standard. And it didn't really matter, and I've seen this with patients over the years, it didn't matter anything else. I remember a mom of a young man, he was in high school and he had terrible migraines and really debilitating migraines, and we found out he was reacting to gluten, and he removed it and the migraines went away, and she went to her doctor, his pediatrician, and said, listen, we figured it out, his migraines are gone, he has a reaction to gluten. And the doctor said, that's fine, so what I'd like you to do is have him eat it for the next 6 weeks, and then we'll do an endoscopy. And she's like, maybe you're not listening to me. My son, who you know has been basically debilitated with migraines, doesn't have them anymore, and the merest bite or nibble or cross-contamination, we've already proven the fact that this is the link, because even just a tiny bit and he will be down with a migraine, and you want me to feed it to him for 6 weeks. And the doctor's like, yep, that's the only way we can make a diagnosis. So I've had so many of those stories that make you kind of want to tear your hair out or do something else more violent. But it can definitely be frustrating and upsetting when your doctor doesn't seem to get it. So what happens frequently is, one, they're stuck on that endoscopy being the gold standard, even though it no longer is. So this has been several years now that this data has been out of the 4 out of 5 rule. So you can definitely tell your doctor about that. And then the other one is the blood testing, because there's a number of tests that you can do to measure the blood for celiac. So there's a panel that should be done. Sometimes they'll just do one test and that's it, like a TTG is the most common one they'll do. And if that's negative, they say, no, you're fine. They really need to do the panel. They should be looking at different parts of the immune system. There's immunoglobulin A, there's immunoglobulin G, so that's IgA, IgG. They should be looking at what's called a total IgA. Don't get confused about all this. I have a very in-depth blog on the website, rootcausemedical.com, where I lay this all out and you can see it in writing as far as all the tests and the interpretation, etc. So for the blood, you can refer back to that. But the other point I wanted to make about the endoscopy is that a very good friend of mine, Dr. Tom O'Brien, interviewed Dr. Marsh. Now, Dr. Marsh was the one that created the criteria for the endoscopy. So it's you get these different levels, and they're Marsh values, 0, 1, 2, 3, 4, and 4, they say, there's no little fingers left, you just look like a flat piece of carpet and or a floor instead of these nice finger-like projections. And what Dr. Marsh said about his own criteria, which he created, so he created these Marsh values, he said that a level 0, which shows inflammation, so the early stages, he considers a positive celiac test. Now, that has gotten misinterpreted, and Dr. Marsh said it to Dr. O'Brien. He goes, I'm not sure how the misinterpretation happened, and he's an elderly gentleman at this point. He said, but that's not what I intended. So not only is the endoscopy not the gold standard, but then when somebody does get one, they can be told incorrectly that it's negative when it's really positive. So it's invasive, it's expensive, they're not interpreted right. There's several reasons why it can be not the best test, and it certainly is no longer the gold standard. So definitely know what the criteria are. If you're having trouble interpreting anything, please feel free to share with me your values and we can talk about it, because I get these emails all the time and I'm more than happy to help, because it's really important that if you do poorly with gluten and you have celiac disease or you have gluten sensitivity, that you know it, because there's just too many secondary effects associated with that. And if that gluten keeps coming in, and we all know gluten is pretty much everywhere in the American diet, but most diets around the world, if it's a protein you do poorly with, you deserve to know it, because changing your diet is something that you do have control over, and that can give you a lot of control over your health. So if your health is not the way you want it to be, whether it's from gluten or something else, please reach out. That's why we're here at the clinic, and I'm happy to give you a free phone consultation or an in-person consultation. And the telephone number here is 408-733-0400. I'll see you soon.